think that the group felt that it was really important that we focus on the uninsured and uninsurable, people who don't have access to any insurance, that population, primarily looking at those people who are between the ages of 18 and 64. Under 18, people are eligible for Medicaid. Kids have that availability. Over is the Medicare population, so focusing on that age group, and then starting to hone in on the income levels of those people who are not eligible for the insurance exchange or any other insurance. We talked about 100% of the federal poverty level tonight, and so what we've talked about is at the next meeting is looking at what the ripple effects are of changing that income level from the current 200% of the federal poverty level down to 100%. So this was a preliminary discussion. It was framing a lot of good information, and now our work is to look at data, look at impacts, and look at what that means to our community. For a family of four, that's around $25,000 to $28,000, something in that area. Those are published guidelines, and each family unit is determined by the number of people in that family. But it is a very low income level for people who are at that federal poverty level. About $45,000 for a family of four, so that could be two working parents who are at a $10 to $12 an hour job wage, or a single person, a head of household who's making about less than $20 an hour.
Do you have a rough idea how much we spend as a county to provide health care for those people who are 200%?
This year we budgeted about $6.9 million. That went to a variety of things. Some of that went to the hospitals to care for those patients who are having in-facility services, some for physicians, some for nonprofits like Turning Points who have their clinic, and to help facilitate some of the costs that are related to that. A good bit of that is for behavioral health, mental health, and substance abuse treatment. So there's just a wide spectrum of services that are provided with that money.